Joe Mullings from 160 Studios, and with me today I've got Dan Rose, who is the president and CEO of LimFlow, and I've got Dr. Dan Clair, who is, I believe, a PI, principal investigator for LimFlow. Is that right, Dan?
That's right. I'm the principal investigator for the PROMISE 2 trial.
And thanks for joining us today. I do appreciate it. Where are you chatting with us from? I understand you've got some new digs in place.
So I'm at Vanderbilt University Medical Center and in Nashville, Tennessee. Just moved here a week ago.
Fantastic. And could you tell us a little bit about the work that you do and your involvement with LimFlow in particular?
So I'm a vascular surgeon, and that means I deal with vascular disease throughout the body. And in the Southeast in particular, there is a critical increase in concern for lower extremity ischemia and ultimately amputation. And we're trying to reduce amputation rates in this part of the country through attention to overall health, but primarily also in attempts at revascularization, meaning restoring blood flow to the lower extremities to try and reduce the risk of amputation.
Why the Southeast from a geography perspective? I've known that before in certainly the cardiac space and now the peripheral space. Is there something about the population, the diet, lifestyle? What is it?
That's a great question. So the only diet that has actually been proven to increase your risk of cardiovascular disease is the Southern diet. So there's a high incidence of obesity here. There's an increased incidence of diabetes. And there's obviously, because of the nature of the crops grown here from a long time ago, a higher incidence of smoking here than tends to be in other places. And they refer to this commonly as the stroke belt, but that involves the issue of carotid stenosis. But there's also an increased incidence of lower extremity vascular disease as well.